In our field, we have always practiced person-centered interdisciplinary care alongside proactive and volunteer-driven leadership.
Hospice started before there was money to provide it. The model at that point was one employee, usually a nurse, and then everybody else who worked for the hospice was a volunteer.
In 1978, from a grassroots volunteer-driven movement, the National Hospice Organization was created to galvanize hospice efforts across the country and provided the needed alternative to the over-medicalized approach to dying. The early hospice community had a vision that was broad.
We were able to prevail upon the Congress to create a permanent benefit, and that's when things began to change more. That's when hospice programs were able to grow their services, expand their services, to begin to reach so many more people.
In 1983, when the regulations were finalized, then we had to go out across the country and make sure providers knew what the regulations meant and how do you start to implement this. Very proud, I think, of the work we did very early on.
NHO was committed to being an advocate on behalf of dying Americans and family caregivers, and recognized the hospice philosophy of care would benefit diverse communities, varied populations, and anyone struggling with life-limiting illness. Today, as NHPCO, we hold true to our roots and carry those same values.
Early on, hospice care focused on caring for white middle-class America with cancer.
We went to 50.4% of people who died in Medicare got hospice. Amazing. We never expected we would see that kind of growth.
From hospice to palliative to serious illness care, NHPCO remains a driving force in setting the standard of care and promoting excellence.
I think NHPCO has a responsibility to make sure that if someone gets hospice care or if someone gets palliative care, that it meets certain quality thresholds and certain standards. We have a responsibility to make sure that the quality of that care is above a certain level.
When I think about the role of a national organization, particularly in hospice, I've always felt that it's truly a beacon. It does provide that really consistent move towards a certain type of quality, a level of quality that we as hospice providers must achieve.
By continually demonstrating how our care model works and improving on its efficacy, NHPCO positions our field to serve as a leader for other areas of healthcare.
There are a lot of experiments and a lot of demonstrations going on in Medicare right now. And I think that one of the ways that hospice can be even more impactful than it is to actually be a part of driving some of those experiments and some of those demonstrations in a way that's actually more person-centered and more interdisciplinary.
NHPCO as a leadership organization can really be impactful.
My belief, having worked in government and advocated outside of government, is that if we have a very solid sense of who we are and what we want to do, person-centered care, interdisciplinary care, then it's our responsibility to go in and show them the kind of care that we provide.
As a national organization, we need to listen to our membership. We need to certainly heed the kinds of things that they are saying, but also help them to walk and feel confident towards an area of change, because it inevitably will happen.
The way that hospice got to be to begin with wasn't because the government came up with a great idea and imposed it. The way that hospice got to be to begin with is that people demanded it.
We make promises to people. We make promises to patients. We make promises to patients' families. We talk about the fact that people will not die alone.
The heart of hospice, the idea that when someone's dying, they need their hands held. They need to be told everything's going to be okay. That can't be replaced with an algorithm or technology, and that has to remain a part of the system that we have. I want to look back with pride 20, 30 years from now and say, while we were here at NHPCO, while you were all there leading hospice organizations, we didn't rest on our laurels. That we saw a world that was hurting, that was isolated, that was sad, and we said we can do something about it. We continued to expand and improve the care system that we had in hospice, and we actually made the rest of the healthcare system even better. That was the whole point. That was what we were trying to do. And I'm really proud to be doing it with you.